Have you ever wondered how to interact with someone who has dementia? It can be very hard and frustrating for the person with dementia and also the person who is trying to communicate with them. I work at a nursing home with several people who have dementia. I understand how hard it is to communicate with them. We are going to look at some different ways to talk to people with dementia without getting them or yourself frustrated. Let's start by talking about some of the best ways to communicate with people with dementia. Being patient, supportive, focusing on comfort, avoiding criticism or correcting, avoiding arguing, limiting distractions, and focusing on feelings, not facts. These are just some of the things that can help you keep the patient calm without getting frustrated. Now let's take a closer look at not disagreeing or arguing with a patient with dementia. When you disagree with a person and start arguing with them, this will cause them to get upset and possibly even violent. No matter what the patient is saying, just let it be. A lot of the times they say hurtful things about you, but you cannot take it to heart. They don't mean what they are saying. Just the other day at work, a lady with severe dementia punched me in the face because she didn't like that I was getting her washed up for bed. I just smiled at her and acted like nothing had happened. I then started talking to her about her grandkids that I know, and that seemed to settle her down. I know that if she did not have dementia, she never would have hit me, but she was confused and didn't know what was going on. I would also like to take some time to talk about when a person with dementia calls you someone else's name. This happens a lot to me at work. One lady always calls me by her daughter's name. She will ask me questions like, how are the grandkids doing, and when will I be having my baby? She will then grab me, put her hands on my stomach, and say she can't feel the baby kicking. I tell her, the baby is doing fine, just not kicking right now. But when it does, I will come and see you so you can feel. Pretending to be that person the patient thinks you are will make them feel safe and more likely to cooperate with you. Many times, family members will come to visit. The person with dementia does not remember who they are. One lady's daughter comes in every Sunday to see her mother. Half the time, the mother will think that she is a sister or an old friend. You can see the hurt in the daughter's face when she calls her by her sister's name. The daughter will just play along and pretend that she is the patient's sister or an old friend. I could never imagine having my own parent forgetting who I am. But this daughter knows that the best way to keep her mother happy is just to pretend. Also, did you know that there is a certain way that you should approach someone with dementia? Well, there is. Always approaching the patient from the front, never from the back. They need to be able to see you coming towards them, so that you do not frighten them. Also, when you are talking to them, you should try to be at eye level with them at all times, even if that means that you have to squat down next to their wheelchair. This will make them feel safe, seeing you not as a threat to them. Every time I enter the room of a patient with dementia, I will tell them step by step what I am going to be doing next. It takes me a little bit longer in each of the dementia patient's room because of this, but the patient will then be more relaxed, knowing what will be coming next to them instead of me just jumping in and starting. Offering comfort to a patient with dementia who is confused is also very important. Many times when a person with dementia wakes up from a nap or in the morning, they will be more confused at this time than they will be during the day. During the day, they don't normally know where they are, but when they wake up from a nap or from sleeping, they don't even know who they are. One lady at the nursing home will wake up from a nap or in the middle of the night and start screaming, "I'm scared, please don't leave me, I'm so scared." She will even start to cry. She gets so scared about where she is and that she doesn't know who she is. Once she wakes up more, she will start to remember more and not be scared anymore. When she gets like this, the best thing you can do is just hold her hand and tell her that there is nothing to be afraid of, and that you will not leave her until she feels safe. Just the reassurance that you are there for her will help calm her down. Another lady will start crying for no reason at all. She will just be sitting in her recliner, and you will walk by and she will start crying her eyes out. Most of the time it is because she is worried about the baby. In her mind, there is a baby who is in trouble that she wants to help. I always tell her that she doesn't need to worry about the baby because I took the baby to my mother's house and that the baby is safe with her. She will always respond by saying, "Oh, that's good. The baby is safe there. Your mother is a good lady and will take great care of the baby. I'm so glad I don't have to worry anymore." She will then stop crying and just relax. This happens about once a day. Just the comfort of knowing that the baby is safe makes her relax. Just the little reassurance saying that it is safe, that the patient is safe, will make them feel more comfortable. I hope that you have learned how to communicate better with people with dementia. Every day at work, I learn a new and better way to communicate with people with dementia. All of the communication techniques that I have talked about will help you calm the patient down and allow them to feel comfortable around you.